We are at 5 minutes past the hour for what is only a 1 hour event, but is a very, very big topic. So first off, just want to say thank you to all of our participants. My name is Kiki Kalkstein. I am the Director of Advocacy and Engagement at Global Health Council. We were very delighted to be asked by our dear colleagues at WHO's Council on the Economics of Health for All to co-host this civil society dialogue in the lead up to COP27. We are tackling a very, very big question today, and one that I will admit, even when we were asked to co-host this session, we were unsure what to title it, because it is a very big topic and there are a lot of different issues we want to explore during today's discussion. So today's event is titled, "Can Economics Help Solve the Climate Crisis and Achieve Health for All?" And today we are having a dialogue with civil society in the lead up to COP27. Our hope for this event was really to engage a range of stakeholders, health advocates, climate advocates, economists, researchers from the health and climate space, and a whole range of any other individuals, organizations who are interested in engaging in these really complex topics. We have a discussion today that's twofold. One is to really hear more from the council and what issues they have been exploring on this topic, and really look at and share about a statement that they have, that is now, I think I can say is officially out in advance of COP27. So we're going to hear about those ideas that have been outlined through that work, and have a bit of discussion, as well as we want to hear from our panelists as speakers really exploring this topic. But we also want to hear from those who are on the line as participants. So part of today's discussion will be a dialogue that I will facilitate between our panelists, and then we'll open it up for questions from audience members, or comments if you all have thoughts on this big question we're grappling with anything on the statement and its recommendations, and we can go from there. But we do want to stick true to, I think for me, what is one of the key words in the event title, which is dialogue. We do want this to be a dialogue. That said, we do have some initial speakers who will be kicking things off for us to really set the stage. And I'm really thrilled to introduce Her Excellency, Minister Hala Said, the Minister of Planning and Economic Development for Egypt, who will be providing today's introductory remarks. And then after that, we will hear from Dr. Ritu Sadana, the head of the WHO Secretariat supporting the Council on the Economics of Health for All. So those two speakers will set the stage for this whole discussion, and then we will go into the dialogue for the day. So that's the plan. Hopefully that's what you all meant to sign up for, and really thrilled to have you all here with us today. With that, I will hand it over to Her Excellency, Minister Hala Said. Thank you so much for joining.
Thank you, and good morning and good afternoon, everyone, ladies and gentlemen. I'm actually in DC, so it's good morning. I would like first to extend my appreciation to the WHO Council on the Economics of Health for All for inviting me to take part in this important session that featured the role of the civil society, which I consider a cornerstone in all developmental efforts. And let me begin by stating that the human and economic costs of climate change are overwhelming. As climate challenges mount, environmental systems are pushed beyond the boundaries. The world will find it more difficult to achieve the Sustainable Development Goals. So our COP27 in Sharm el-Sheikh provides one distinctive opportunity for all stakeholders to stop to step up to the challenges at hand and move quickly from the discussions and the ideas phase to the implementation and the solution phase. That's why we call it from pledges to implementation. It's an action COP. Health and climate change are intertwined and cannot be thought of independently. They both require unprecedented coordination and a radical transformation from business as usual. The climate crisis will have adverse consequences on human lives and health. Almost 25% of deaths worldwide are caused by environmental risk factors, and estimates get much worse as the effects of climate change increase. That said, it is very important that health systems are better prepared for the climate change-induced effects. Furthermore, a climate-resilient focus must be incorporated into strategic planning for the health sector to reduce its contribution to the GHG emissions and ensure more sustainable service provisions. In addition, transitioning clean energy, more sustainable food systems, and cleaner transportation system can generate massive public health benefits that will spill over as people live healthier lives. Ladies and gentlemen, the cascading challenges necessitate a novel approach to economic thinking, and the WHO Economic Council has been pioneer in this area. A novel approach is very important to ensure that the policy narrative evolves in a direction required to address the climate and health crisis and to make sure that the developmental paradigm promoted by international institutions is oriented toward the health of people and the planet. Indeed, in this respect, Egypt's Vision 2030 guiding principle as we integrate climate matters in all our development agendas. This is also reflected by one of our very important initiatives that is called the Decent Life Initiative, or the Haya Karima, as it seeks to revamp rural communities, expand treatment and preventive services, and provide decent housing, among other benefits, to those most in need, all in a climate-sensitive manner. The civil society is a key pillar of this initiative, driving the delivery of the project as swiftly and effectively as possible. On that final note, I cannot stress more the vital role of the civil society plays in tackling the most daunting of challenges and achieving the much-needed breakthroughs. Looking forward to COP27, the Egyptian government will ensure the civil society's voice is heard and will encourage conversations with civil society organizations in the lead-up to COP27 to ensure their perspectives are properly represented during the negotiations. Our recent experiences have taught us that the crisis we face, whether it's climate, health, economic, political, are overarching in nature, and thus collective efforts of all parties, including the civil society, are crucial to advance much needed change. Thank you very much.
Good morning, good afternoon, good evening, Her Excellency Minister Hala Sayed, distinguished panelists, members of civil society organizations, colleagues, ladies and gentlemen. We are deeply thankful to Her Excellency Minister Hala Sayed for her comments. As many of you know, COP27 is being organized and hosted by the government of Egypt, and Her Excellency is leading COP27 planning efforts and has played a tremendous leadership role on Health for All in Egypt, including during the COVID-19 pandemic. The relationship between climate change and Health for All was highlighted clearly by Dr. Tedros, WHO's Director General, who described that the COP24 Paris Agreement as potentially the strongest health agreement of this century. Dr. Tedros also convened the WHO Council on the Economics of Health for All as an independent voice to provide evidence and advocate for creating an economy for health. This requires investments from a whole of government and whole of society approaches, with the goal of protecting and restoring the health of humans and also the planet. Council members are fully committed to the cause. Council member Kate Raworth, using donut economics, concludes that no nation currently operates within the planet's boundaries while meeting the needs of all its people. Council member Marilyn Waring has documented time use as an alternative to GDP-centric policymaking including valuing effort to preserve and sustain land. The Council's chair, Mariana Mazzucato, will be convening a session on the links between health for all and climate action at the upcoming COP27. We look forward to carrying insights from today's conversation into that discussion. Now, the Council recognizes much more work is to be done related to the economics of the intersection between climate and health. For starters, internalizing so-called externalities is key to reorienting economies for health. Indeed, levying a global carbon tax and eliminating direct and indirect subsidies to fossil fuels would account for about 50% of the reduction in emissions required to comply with the Paris Agreement. In the Council's COP27 statement released today, we call for renewed political commitment to increase the ambition of nationally determined contributions and the relevance of health in the COP negotiation process. Please read our statement for further details, including how reducing fossil fuel subsidies is estimated to be more than $5.9 trillion globally, to rethink the underlying definition of debt sustainability and the driving forces of sovereign risk to increase the fiscal space for investment in this common good, to tax particular forms of carbon-intensive consumption that only wealthy households consume, and that international financial institutions recognize global common goods as part of their core mandate. We thank the Global Health Council for co-hosting this dialogue, and we are committed to ensure an inclusive process to influence the negotiations at COP27, as well as to inform the Council's final report that will be released in May 2023. Thank you very much, and looking forward to discussions from all distinguished panelists.
Wonderful. Thank you so much to both of our speakers for their introductory remarks. Minister Hala Said, we know you are very busy. Like you said, you're here in DC, where I'm also based, and just really are so appreciative of you taking the time to set the stage for the conversation. And also, I think from my perspective and for many of those on the line, your clear commitment and thinking on how civil society must be engaged in these ongoing discussions as we grapple with the big challenges that I think that we are facing together. So thank you so much for your time. And Dr. Sadana, for laying out kind of the thinking of the council, and really appreciate you outlining what you all are doing and the ways that civil society can really engage with your recommendations and the work of the council going forward. With that, I'm really thrilled to invite all of my panelists to come onto video and we will start the dialogue segment, the facilitated dialogue segment. I think it's been noted a couple of times that we have a range of different perspectives and backgrounds on this call. So I will just start out by saying I am a health advocate. I think we all in our day jobs wear many hats, but I'm not an economist. I am not a climate change expert, but I am really thrilled to be joining and have our panelists with their different perspectives able to weigh in on these discussion questions. I am also not an implementer. I am not a researcher. I am not a funder, but we have a very diverse group of panelists with us here today to help us start thinking about how we may address this really big question that we posed as the title of this session. So just very quickly, I will go through our 5 panelists. We have Dr. Jenny Miller, who is the Executive Director of the Global Climate and Health Alliance. We're also joined by Dr. Marina Romanello, Executive Director of the Lancet Climate Countdown. We have on the line Martin Muchangi, who's the Director of WASH and NTDs at AMREF Health Africa. Dr. Alice Bell, Head of Climate Policy at Wellcome Trust, and Emmanuel Ojiwang from CARE, South Sudan. Thank you again to the panelists for joining. I think we have some tough questions for you, but I think you're up to the task. So with that, I will address our first discussion question to just a couple of the panelists. The council promotes, and I think as Dr. Sadana noted, the council promotes the creation of end-to-end innovation ecosystems with access and affordability at their core. WHO, for example, supported a program to urgently scale up solar oxygen concentrators in Somalia, which successfully reduced maternal mortality and child deaths while providing reliable, cheaper, and cleaner energy. So from your perspective, we would love to hear, how should technology transfer be governed and deployed so that low and middle income countries have access to much needed technologies that can improve health outcomes, increase mitigation and resilience, decrease dependence on the global north? It's a big question, and I will first turn to Dr. Jenny Miller for your thoughts on that, and then invite my colleagues Martin and Emmanuel to chime in. Jenny.
Thanks, Kiki. Thanks so much for the question, and thank you for inviting me to join this conversation. I actually learned of the existence of the Council on the Economics of Health for All by being invited to this, and I'm so thrilled that the Council exists, because that kind of economics piece of how we make the transition to a healthy, sustainable world that provides a basis for health for all. The economic piece is the nut that I feel like we continue to have trouble cracking. My own background is in public health, and in public health, we know that it's far better to keep people healthy in the first place, and far harder to provide the care to once they've gotten ill and need to go through extensive healthcare, advanced healthcare. So innovation in order to provide health for all really needs to be multifaceted, and it's going to be key to addressing the challenges that we're facing. The development path that brought huge gains in health and life expectancy in the global north has been dependent on the use of fossil fuels and significant resource extraction. And so because of that, yes, we've seen those gains in health and life expectancy, but we've also seen significant harms come along with that in the form of pollution and in the form of impacts around the world, externalized impacts. Some the countries in the global north are benefiting from this development, but spreading the harms around the world. And the most notable example of that, but not the only example, is, of course, the climate crisis that we're seeing unfold all around us. And that has been impacting lower and middle income countries far more significantly than the global north itself. So in order to move out of this crisis and towards that healthy, sustainable world that we want, we are going to need to develop and enable countries to develop and have access to energy and transportation and education and healthcare for all. But we need to do that on a different path, and that's going to require innovation. And in fact, we have some of the solutions that we need. They're just not taken to scale yet, and they're not shared around the world. So I think two really important things need to happen, we need to find ways to share those technical innovations and provide technical support to low and middle income countries, to developing countries, and do so in a way that doesn't burden them with added debt or obligate them to stay locked into longer term commitments with global north corporations, for example. But in addition to that, we're also going to need to support innovation, and there is the potential for great innovation to come from communities that are facing the challenges that they see before them. So supporting that innovation at the local level, at the national level as well. All this needs to be done in a way that prioritizes health and well-being, and really looks to that transfer of technology, that shared innovation, as something that's a global good and a public good, and not simply something for profit.
Thanks so much, Jenny. I think the innovation question, like you said, we're grappling with it in and the technology sharing and all of that. We're grappling with it in each of these spheres we're talking about in health and climate, and really appreciate your perspective. Martin.
Yeah, so thank you so much, Kiki and the organizers, for inviting me to this panel. I want to start by saying, or redounding the words of Minister Said, that indeed we are now facing a triple crisis of climate change, dwindling economies, and that is also affecting our health and the health of the communities who we work with. So unfortunately, the issue is this is affecting the Global South more than any other place in this planet. And this is where adaptive technologies and capacities are lacking. So just to share a little bit of reflection, and I'll speak from a practical perspective, the environmental determinants of health, which is more or less of clean air, clean water, and all that. We are very clear that in Africa and other places, there is lack of these technologies. And we know, like, for example, about 2.8 billion people in the world are using dirty fuels. That is solid fuels, talk of charcoal, talk of, wood, etc. Of course, that has a direct effect on environmental degradation. And at the same time, the production of the particulate matter, which produces particles causing pulmonary diseases and all that. So at the end of the day, if you look at a practical example of a country like Kenya, where I live, we already know that about 5.8% of people are actually having disabilities because of this, and about 7.5% of premature deaths. So that's quite significant from a public health perspective. But the key issue is, what is it that we know has happened quite well? And looking at it from the private sector perspective, public sector perspective, civil society perspective. So for me, I'll share like 5 reflections and I pack them into P's. So the first reflection is around how do we make sure that we are putting people at the center? So people-centeredness, whatever we do is supposed to be contextualized, whether they are process innovations, whether they are technological innovations, they are supposed to be packed and contextualized to the people who we serve. The second P is around the policy framework and the enabling environment, ensuring that actors can be able to operate within the premise that their action can come out best. So is it about tax rebates? And from a very practical example, if you look at the solar energy, like what the government of Kenya did, it lowered the taxes and therefore accessibility and affordability of solar lighting systems in rural households actually became practical. So the other piece around P is the public-private partnership, asking ourselves, what are these arrangements that we need to construct to ensure that the private sector has the space to innovate and to ensure that the products that they innovate actually gets to the market in a manner that it can be absorbed and to help even be able to, those who are at the bottom of the pyramid. Now, the other reflection is around how we manage some of the pilots that we have put forward. So are we putting forward novel ideas, novel system, user cases? How are we managing them? And how are we helping individual entrepreneurs to manage all these pilots? How do we mature them? How do we facilitate the financing and all that? So, and the last P is around measuring impact, because again, this should be participatory. It's participatory, multi-sectoral measurement of impacts, communicating that, telling the story in a manner that whoever is responsible, any stakeholder, whether government, civil society, private sector, can be able to absorb that message and facilitate the process of innovation, do that culturing that enable all those things to come forward. I want to stop at that so that I listen to others and I'll be able to take questions moving forward. Yeah, thank you.
Martin, thank you so much for that, and I like how you packaged the responses, and it helps remember. It helps us all remember, I think, those important key pieces to consider on this big question of technology transfer. Okay, I'll turn to you, Emmanuel Ojuang from CARE South Sudan. Would love to hear your reflections on this question.
Yeah, thank you. Thank you so much. So looking at the issue of technology transfer, I would like to say that technology is available, the technology that would be able to change the lives of the people, especially in the global south. It is available, but unfortunately, it is not affordable. And it is, in most cases, it is actually unaffordable to the people that need it most, the people who would be impacted by it most, and the people who would benefit most. Looking at South Sudan, where I work for CARE, we have been suffering from extreme weather events, and these have actually gotten worse in the last 3 years, where we have flooding alternating with drought. And as we are speaking now, we have a record number of people displaced. Out of around 12 million people, the population of the country, 1 million people are displaced. Out of these, 400,000 are children. And with these, we have about over 1,000 health facilities that have been destroyed, and about 1,000 nutrition facilities that have also been destroyed by the floods. And looking at that, the risk that comes with flooding, wash facilities have also been destroyed, and therefore we see a lot of preventable outbreak of diseases and vaccine preventable diseases, malaria, watery diarrhea, and also pneumonia. The rates have actually been increasing across the country as with the flooding. Now, we know that interventions in wash and vaccination are low cost, and they have the highest impact in public health. Unfortunately, for instance, vaccination, when we are talking of solarization, we have been trying to solarize our health facilities because only according to recent studies, less than 40%, about 40 to 50% of the population have access to health services. The others do not have access. And this means that even if we wanted to solarize, we would need some basic, you need a health facility to solarize it, to have the fridges. That can happen, but some of the communities live over 12 to 20 kilometers away. And this means, therefore, that access, infrastructure challenges becomes a big problem. And therefore, there are newer technologies, like, for instance, ACTEC. ACTEC is actually a passive vaccine storage device that can provide long-term storage over 35 days. And this has had a huge impact in some of the locations, some of the flood-affected locations where health facilities have been destroyed. The entire cold chain system that was supporting vaccination has been destroyed, and therefore we are relying on such technologies. However, like I mentioned at the beginning, there are impediments, and these include things like cost. There are challenges like taxation. If one wanted to import, there would be challenges. And therefore, this has impacted organizations that would otherwise have liked to import them and deploy them on a large scale across the country, especially in the locations that are affected most by flooding. So the question is local manufacture possible? And what does this mean? Is local capacity available, even if not in the country, in the region? So that is what comes. And as we saw with the COVID vaccination, this is a reality in the global south where access to technologies becomes a challenge because of various reasons. So as we go along, we hope that these technologies, which are available, are made available to the global north where they are needed most, and they will have the biggest impact on people's lives and their health. Thank you so much.
Thank you so much, Emmanuel. I think, yeah, connecting the issues and hearing about your direct experience in South Sudan is so important as we grapple with the big questions in innovation. So that was the first big question we had: innovation, technology transfer. None of these are small topics. And thanks so much to our first three panelists for giving us your perspective on that. I'm going to turn to our second question now. That's on another big topic, which is the funding and the financing piece of all of this, of solving the climate crisis, of achieving health for all. So I'm really excited to hear from our next two speakers on this value finance kind of funding question. As a little background, the Council promotes the adoption of values, goals, and metrics beyond GDP, guided by what really matters: the health of people and planet. So Dr. Romanello and Dr. Bell, we'd love to hear from you on your thoughts on how should current funding, both international and domestic, be governed to maximize its impact, including the variables and key performance indicators on how we make decisions on those investments that are taken and evaluated. Is there an investment framework like the Green Climate Fund? Is that necessary? Right? What do we actually need in the financing and kind of funding realm of solving these challenges? Dr. Romanello, I'm happy to turn to you first on this very easy, simple question.
Thank you, Kiki, so much. Thank you so much for inviting. Yeah, it's an easy one, isn't it? We're going to sort it out today, I'm sure. Just as a big caveat, I am not an economist and I don't generally operate in financial systems, but I have a couple of insights. And I think the work, I agree with Jenny, I hadn't heard about this initiative before, and I've been reading your documentation. I thought it was magnificent. There's no doubt that our current economic system that is based on GDP and based on a paradigm of infinite growth is incompatible with the planets that we live in, with the planetary boundaries. It's very clear that it's jeopardizing our health today, and it's jeopardizing our future to the point that we don't know whether our children will have a livable future. And that was said very clearly by the Secretary General of WHO. There's definite flaws in the whole economic structure. I think we're seeing it very clearly today with the energy crisis. While people grapple to afford energy that they need to keep their homes at healthy temperatures, to live sustainable lives, to have healthy lifestyles, the fossil fuel industry is having millions of in windfall profits, records windfall profits, absolutely unexpected and absolutely off the back of an energy crisis. So that shows just how wrong our current system is, I think, very clearly. One of the things that perhaps is the most noticeable is that the health impacts of the climate crisis are never being taken into account in investment activities. You mentioned the Green Climate Fund. The Green Climate Fund has very few of their initiatives that are actually tailored to the health sector. And accounting for those negative externalities is incredibly difficult because they're very, very difficult to quantify. The initiative that I lead is focused on developing metrics and indicators. And some of the things that we try to do is capture what are the economic costs associated with the health impacts of climate change and how we can quantify the economic benefits of accelerated climate action. And we go to enormous lengths in trying to capture that. And for some indicators, for some aspects, we can. But what is to me very clear is that there's a big area that is unquantifiable. And when we think about what really matters to us, when we think about our health, when we think about the right to health, the right to a healthy environment, the human rights to a healthy environment, that is unquantifiable. So I think when we rethink these frameworks and how international investments should be governed, we need to keep into account that perhaps metrics have their own limitations, and perhaps that is not the way down to go, because this locks us into the same economic system that we're operating today. We cannot quantify in monetary terms those unquantifiable losses because it locks us into the same GDP framework that we're operating today. So I think we have to rethink the way in which we value life, in which we value our environment, and in which we value intergenerational justice and a healthy future, and incorporating that into financial frameworks, acknowledging that we might not ever be able to quantify it, and it is unquantifiable. We cannot put a price to the life of the people that we love, and that has to be the starting point of this discussion, I think. Just going to the most obvious, while we think about how these international finance systems need to operate, we still have governments that are allocating literally hundreds of billions of dollars to subsidizing the fossil fuel industry. So I think we are one step down in that conversation still. That is, we have to stop financing the things that we know are harming our health and jeopardizing our future. That is the first thing. And knowing the things that we need to stop financing, that's knowledge that we already have and that we already quantify by and large, then is when we have to start thinking about, well, what is it that we have to redirect those funds to? And again, the quantification and the operating framework for that, I think, needs to take into account that much of it will not be quantifiable, but we need to have benchmarks of what needs to be funded and what cannot be funded any longer.
Wow. Thank you for those thoughts and reflections. I can't wait to go back to listen to this recording and recapture some of those nuggets that you shared, because I think your reflections are on the metrics piece and what we can measure and how that governs our decision making on what gets funded, but then what we can't, and recognizing those limitations is so important as we think about what our goals are. And if we want to come up with all these big frameworks and decision making on what gets funded, what doesn't, all of that, we have to, and we are trying to be diligent and ensure that we're measuring the right things. That has to come with acknowledging that actually there is a whole host of what we want to achieve and the negative impacts that we can't quantify, and what does that mean for how we actually then approach and tackle these problems. So thank you for that framing. And and attempt to start getting us toward answering this very big question. I'll turn next to Dr. Alice Bell for your reflections on this this broader financing question.
Hello, and thanks. And I just want to echo what other people have said. This is such an interesting issue. It's such an important issue. It was really nice to be invited, and it's been really fascinating hearing people's reflections so far, and reading what the council's been doing. I think I've got similar things maybe to say. As Mariana said, I'm going to try not just to repeat you, but I think it's very clear, as your report says, that we need more and different funding. I think that's the first thing we need to say, really, and keep that in mind, is that, you know, we need significantly more money to be put into this area, and we need to be doing it in different ways. And I think as the quantities increase, we're going to need to have some really important conversations about governance and about who controls it and who is in power with this money. Ultimately, you know, the flow of money often comes down to power, and it is a very political issue that we need to continue to have a lot more conversations about, robust, challenging conversations, which include a range of different perspectives. I'm looking forward, like a lot of you, I think, to hearing quite a few of those conversations at COP. I think it will be very much a big topic in the next month and afterwards. And we'll see how it plays out, and how the chance to, I think, to really have a conversation, particularly around things like loss and damage, will play out into longer term climate policy conversations. I think in terms of sort of recent stuff that we have seen some movement to kind of financing bodies like the European Investment Bank saying that they were going to end fossil fuel financing, you know, some kinds of forms of leadership in this space. Certainly a real push against fossil fuel financing. That's one of the areas where I think we see civil society involved, and various campaigning groups, mobilizing grassroots activists, getting involved in the financial discussions of climate change, which can be quite esoteric. I think we need more of that, but really something particularly at Wellcome that we'd push, and I think it's echoing what colleagues at the Lancet Countdown would say, is that we need to be including health impacts in our analysis of in what these groups like the European Investment Bank, the World Bank, in terms of what they're funding, they need to be including health impacts. And ultimately, this comes down to why. So I started at Wellcome in July. It's a new program for Wellcome on climate and health. One of the things that drew me to the role, to this project that we're setting up at Wellcome, is that I think that the health lens is so vital to us in climate policy space. And it's one of the ways in which we can ensure that it's a route to climate justice. You know, it's one of the ways in which we can ensure we're having an equitable conversation about climate change. So you have a lot of these groups like the European Investment Bank saying, equity is really key for us, right? Great, equity is key for you. You need to be looking at the health impacts of climate change, because if you aren't looking at the health impacts of climate change, and you aren't looking at how we're counting the health impacts of climate change in some parts of the world and not others, you are not going to have an equitable evidence base for your conversation. So I think it's really important that we push this point that health research is one of the routes to equitable climate policy, particularly through these financial institutions, not just through the usual people who talk about health and equity. I think just to kind of wrap up, I'd say as a Wellcome Trust are primarily a research funder, and we are really keen to fund economics research. So if you know any economists, I started that word wrong. Sorry, English is my native language and I'm still struggling with it. If you know any economists who are interested in this area, encourage them to apply to Wellcome for funding, and to I think we really need to grow the economic understanding of this area. Those of us who've worked in climate policy for a few years will know that economics as an academic discipline can sometimes be a bit problematic for us, but there are lots of economists who are keen to work with us and to help bring their expertise and work with other areas of expertise. And I think we really need to grow that enthusiasm. You've got some really great economists working with you. Mariana is a former colleague of mine from the University of Sussex. Love her. We need to clone her and have many more of her, and find other people but there are many other people like her around the world, and we need to build on that expertise. And we also, I think, need to get people talking to each other. So we've got people who will say, on one side, this health impact, or this life we cannot put a value on it. We cannot put a number on it. I think that's a very justifiable position to take. But on the other side, you can have people saying, I need something to put in my spreadsheet. And we haven't got time to sit around having a logjam on that. We need a way through this. We need to have conversations about, all right, what kind of systems we're going to have. So either we change your spreadsheet so we can put something in it, or we can give you something. And how can we have a dialogue between two different, ultimately different approaches for looking at the world, so that we can find the governance routes for this. And I also think we really need to bring more people into the debate. You know, climate policy can be very esoteric, finance policy can be very esoteric, but ultimately this is a really important global justice point, and it is a point about health. It's a point about human well-being and life or death, and we all need to be involved in it. And so those areas of civil society that have been really good at getting people engaged with kind of end coal financing and conversations about that, we need to be bringing more and more people into that space, because that's what's going to democratize that governance conversation. And I'm really keen to see more and more climate activists starting to have a financial conversation. So let's hope, as with COP, that kicks off a bit more of a broader debate, not just at COP, not just in Sharm, but around the world, as people are looking at what's going on in the Sharm el-Sheikh talks. So we can try and have a big conversation involving lots of different people about this vital, vital issue.
Wow, Alice, again, thank you for those reflections. I think for me and for Global Health Council, the connections on the equity piece and really how we look at that and what that means. Like we need to actually look at the financing, what is financed, what is invested in terms of research, and how you connect those conversations. And in order to actually achieve that equity and justice we're talking about, we need to bring many actors, as you noted, together into the same room, into the same conversation across climate, health, financing folks, all of it. It all does need to be together. So really appreciate those remarks. I know that we're short on time, which I will say 0% surprised by. What I'll do next is actually just ask my panelists for any reflections on other comments made by panelists. If you want to say one quick thing in response to what you heard from one of the other speakers, I would love to invite you to do so. We have a lot of folks on the line too that I'm sure had many questions. From my perspective as someone who would like to see this conversation continue to bring in different folks across civil society actors, across the health space, across the climate space, across with economists and the rest. I'd love for any participants, please drop your questions either into the chat or into the Q&A function. We'll continue to collect them so we can continue to use them in future convenings. But I want to hear any quick responses from our panelists or comments on any of the reflections made by your fellow panelists. And then in the last few minutes, I'll turn to our other colleague from WHO for some closing remarks. But any panelists' reflections on each other's comments?
I can make it here a very quick reflection, particularly responding to Alice, because obviously I thought her comments were spot on, and the need for cross-disciplinary work and unsiloing the conversation on health, the conversation on climate change and on economics is fundamental to be able to incorporate the health dimension of our financial investments to ensure that our new transformation of this space takes into account the full economic costs and the full social costs of those activities is crucial. And I agree, the Wellcome Trust is doing an enormous amount of work in trying to break those boundaries, but there's a lot more yet to be done. And these conversations at COP27 are so important. So the health community has a good opportunity there to start getting more involved into the conversation and breaking those silos so that health is really central to the COP27 conversation.
Let's see, I'll go to Martin, and then I think Jenny, you had your hand up as well next.
Yeah, sure, thank you. I would want to speak to the question that has been posted by Koyenjo. Koyenjo is asking whether it makes sense to promote the cleaner energy versus the fossil fuel, because that makes more economic sense. And I totally agree with you, Koyenjo. The key issue here is the just energy transition. So I understand that it's not so easy to transit from solid fuels like with immediacy. But then if you look at accessibility and making cleaner energies affordable, That's what we should be targeting. And I think that's what my speak was focusing on. Yeah, so thank you.
Great. Thank you. Thank you again to our panelists. I wholeheartedly agree on the multidisciplinary cross-sectoral needs that were, I think, brought up by many of you, and look forward to continuing these discussions. I will not be at COP, but it sounds like many of you will, and hopefully we'll be able to connect with a range of other health advocates, with other folks who are really in on the financing piece of things, and the rest. So thank you again for all of your reflections. Like I said, the recording will be available, so we'll share it with participants, but also with those who are not able to join, because I know it is an incredibly busy time on everyone's calendars, I think, who work on any range of these issues. So we will share it more broadly as well. And I will definitely give it a listen back to better absorb some of the really thoughtful reflections from you all on the discussion questions we posed. So thank you again to all of our panelists. I'm delighted now to turn it over to my colleague, Dr. Daramid Campbell-Lendrum from WHO, who will provide our closing remarks today. Over to you.
Yeah, thanks very much, Kiki, and thanks to the panelists and to the council for organising what has, really been a fascinating discussion. And in many ways, I think it is the discussion that we need. Many of us who have worked on climate change and health for some time, I think, although the field has grown very quickly within the last couple of years, I think we sometimes feel that we're sort of dealing with the end of the chain of a series of decisions that are basically damaging health, but have taken place further upstream. So we spend a lot of time working with countries to improve their surveillance systems for infectious diseases, or to help them to deal with floods and droughts and the kinds of things we were hearing about from Martin and Emmanuel. And yet the actual sources of these problems have taken place in boardrooms, in discussions very far removed from the places they're actually affecting. And I think, as the council has made clear, and as I think the discussion has made clear, we basically clearly have a dysfunctional economic system. It's now 30 years since Bill Clinton won his election on saying it's the economy stupid. Now we have the stupid economy. We have a system in which massive investments are made, which have profoundly damaging impacts on the planet, but also profoundly damaging impacts on health. And yet those health consequences are not properly included within these economic decisions. It is clearly crazy that financially we spend $400, $500, $600 billion a year directly subsidizing fossil fuels. And as I think we heard in the opening remarks, if you take into account the damages to health, it's an effective subsidy of about $6 trillion a year, according to the IMF. And IMF, they're not climate activists, they're not hippies. That's the hard reality. And yet the governance of those decisions is far removed from the people who have been involved in this discussion up until now. And so it's really fantastic to start to have the firepower of big scale economists who are able to talk this language, who are able to not only to quantify these things, but to give guidance on whether it makes sense to quantify these things, to put a value on a human life, or to say that's too important to value, we'll just talk about the lives saved, or health is a human right. Because I think, as Alice touched on this point, at the moment, we're doing neither of those things in our decision making. We're not valuing those human lives as dollars, because if you do value those human lives as dollars, the calculation comes absolutely in favor of a much cleaner energy system. And we're not valuing them enough as a human right and human lives that had to be protected because they're too important to value. So I think, so we need the academic discipline and the research and the joining up of research between economics, climate change, and health. It has to, as I really like the points that several people were making about joining up different communities, because even with the best analytics in the world, you know, that we can do, or we can do with Lancet Countdown and others, as again, as been mentioned, it's actually about the power of who takes those decisions. What is the governance of those decisions? What are the incentives that are actually making those decisions going effectively the wrong way for climate and health? Because the economics argues against it, the figures argue against it. The figures are very clear. If you take into account the health gains that would come from meeting the Paris goals, the intervention pay for themselves. If we were able to make the transition to clean energy, we would, I understand the latest studies say, we would have made that money back directly financially within 6 years, and then everything else is profit after that. So the answers on the economic side are, you know, becoming clearer and are very much in favor of making this transition. So the question then becomes a political economy question as to who's in charge of taking these decisions. Why are they always short-term decisions that effectively favor polluting industries, and how can we get that changed? So we do need this joining up of the best evidence that we can possibly have, the economic understanding to be able to talk about the language of economics with that broad civil society approach, and the activists who are able to also understand those arguments and to build the public pressure which should change this. So it's yeah, as I say, it's been a fantastic discussion, and I think it has to carry on scaling up, because at the moment, the other thing I would say is that aside from being used to sort of not fast enough progress, we can't let this discussion just be fobbed off by a few projects here and there, or even a few billions or tens of billions to deal with this issue. So the climate negotiations should be raising $100 billion a year to address climate change. They're not getting that money. And the multilateral climate finance for this, things like the Green Climate Fund, is on the scale of $10 billion every few years. It sounds like a lot of money, but it's absolutely trivial compared to the scale of the investments that have to be made, and will pay for themselves, but have to be made outside of that sort of end of the line. Here's a bit of money to try and fix the problem at the end. So as I say, from our point of view at WHO, this is from our climate change and health program, this has been a really useful discussion. I do hope that it's the start of a more substantive building of a partnership between climate sciences, health sciences, economic sciences, but between those different stakeholder groups, including civil society and political groups, that can help to drive the political action that we need. So we will be at COP, and we'll look forward to trying to continue to progress this through COP, and unfortunately it'll have to be through future COPs as well, but this seems to be a very good start. So thanks very much, and back to you, moderator.
Great, thank you so much, Dharmid, for your comments there. Dr. Sadana, a final word from you, from the Council on the Economics of Health for All. I realize we're just a couple minutes over, so we'll wrap up very quickly for those on the line, but I would love to hear a final comment from you, and then I'll close us out, and we will all continue to think about these big questions and how to better, I think, work together and collaborate.
Yeah, thanks very much. Let's see if we can schedule
Dr.
a
Sadana,
second round of discussion where we can have participants also ask questions and share their views. Collaboration and scaling up to the investments. I heard what Dharmid said, we need 100 billion a year, and that we'd get a much greater return if that investment was made. Thank you again.
Thanks, everyone. My final reflection is one that, yes, civil society has to be part of these conversations, right? And again, as Global Health Council, we appreciate the invitation to co-host this dialogue and continue to push for civil society engagement at all the decision-making tables that we're discussing here at WHO, across the development banks, within, individual governments, and continue to include civil society for their input and their insights into how to solve these massive challenges we're talking about in terms of climate change, achieving health for all. And the other reflection I have is something that I reflect on often, which is what I heard constantly from a professor of mine when I was in college, from Ananya Roy, that you need to be a double agent, right? We're talking about our individual lives as health folks or climate folks or economists, but we all need to be, if we want to tackle these big issues, we all need to be double agents. So committing ourselves to that and being able to identify ourselves as climate and health advocates, climate and health researchers and funders, and maybe all of us brushing up on our economics and understanding of the very complex international financing system that we live in. But let's hold to that, our commitment to being double agents and continuing to have conversations like this one. Thank you again all for your participation, and see you soon.